Welcome back for another weekly COVID update. I'm honored to be joined today with our flagship rehab team. And we have in the center Bryan. Bryan is our site manager for this team. And Bree and Lucille are here with us to talk to you. And what an honor to be affiliated with this group. It really, their team provides the motivation and the inspiration that we really march on. So I'm really honored to be here with them today. So we want to talk about some things related to the work that's happening in their department, what they do as they interface with the residents here, your family members. Bryan, from the perspective of working with the residents, things have changed a lot. We're in a room and we don't have any residents in the room. Obviously, we're here for this conversation, but normally we'd have many residents in here. How has COVID-19 changed your perspective in your delivery of care?
As far as that goes, we've really not changed too much in how we're treating the residents. Our goal has always been individualized care, treating, what that resident needs, what that resident was here for, whether they, need to go back home, they're going to an assisted living, or their goals to return to long-term care. So we've always been basing our treatments, towards that individual person. Typically, we would do some type of group activities. We would do exercises in the room where there's other residents. You can see what's going on. They've got that camaraderie around here to, really cheer them on. So now we've had to kind of play that role on our own, to support them, to make sure that they know that they're here for, their therapy, but they're also, they've got people around them that care and want to help them. Whereas before they would have their families and friends to do that, and they don't have that right now.
So you raise an interesting point. Therapy provided oftentimes in the presence of many people, right? And that's supportive to the individual. There's reasons for doing that, and we're doing more one-on-one to regard and be careful around the spread of COVID and infection control. How has, from all of your perspectives, how would you evaluate, or what's your observation with regard to how this is influencing the residents who are coming or you're going to see for service? In terms of their mental outlook, how has it affected them, and what are we doing about that?
I think, like Bryan said, it's really important that we come up with an individualized plan, and working with them one-on-one, we really get to know the residents and know exactly what they need. They need encouragement, they need some positive feedback. So we're constantly encouraging them to get up out of bed, and encouraging them to participate as much as possible, to keep them interacting with us and, with other staff members.
Looking at short-term rehab, I guess the missing out on the physical family support, like some families come here, visit, and see how they're doing in therapy. We don't have that anymore. But the fact that activities is helping out with Windows visit, FaceTime communication, or through video calls, I think that is helping a lot the residents, and communication with the family, like we're giving out, we're calling them and giving them updates with how their families doing here during rehab. That is also helping. In terms of one-on-one, we do think out of the box, because we don't have that what do you call that, the simulation of when we have residents here working out and they see other residents doing their own rehab too. That kind of motivates them to do better. But being with them in the room with no one else to see, doing other exercises, that kind of makes us think of other ways to make them more motivated. So we're thinking out of the box now, doing our therapy. It's
Okay.
just a little different from what it used to.
So I've asked this question of other groups and departments. We're now 4 months into the COVID circumstance. It's a new way of life. We're hoping that we go back to what we had before. We will. We're confident about that. But what takeaways have you seen as a group individually in terms of how you work? Is there any part of what we're doing now that we've learned that we're going to apply differently in terms of moving forward post-COVID?
As for me, I've become more aware of infection control now, like making sure that our equipments are wiped off after treatment or before treatment, washing hands more often now. So I think that's gonna carry over
Greater
to
sensitivity to some of those
yes,
things.
exactly, yeah.
How about you, Brian?
And to that point, I think family involvement has, really opened our eyes as to how much we need and those families to support us and those residents. When things, finally do get back to normal, really having them here for participating in the sessions, working, training those families who are going to eventually possibly be the caregivers of those, residents when they go home is very, very beneficial to them, and just that socialization aspect of it as well.
Kind of going off of what Brian said, family involvement is so important, and we're here and encouraging the residents, but I think having the family support is so important. And we see it, we work with it all the time, and we're educating families, but whenever the families are here, making sure that they're understanding exactly what their family members will need going home, especially if they're going to be home in the home with them. But I think that the infection control, we've really stepped up in that area, wiping everything down before and after every treatment session, and then working with the residents and encouraging them so we can hopefully get them back as soon as possible.
Okay, Bree mentions infection control. The Westview Terrace unit is for residents under observation, and you're in full protective mode in terms of your PPE. Share a little bit about that, because it certainly, I see Lucille, I see all of you, you look like physicians coming out of an operating room. How is that working? How is that received? Any thoughts on that particular?
It was definitely a change of how we, like Lucille said, thought about infection control now that we've moved to wearing the full PPE for the residents who are here for their first 14 days under the isolation protocols. We work very closely with the facility daily, if not weekly, to communicate those types of things, making sure that we all have the equipment that we need, the supplies, and just making sure that we're being mindful about not spreading from patient to patient any possible risk. And I think it's been very eye-opening, and I think that as a facility and a team, they've done a great job of working through those PPE, and it's been difficult. There's no doubt about that. It's been hard to do, but I think that everyone's done a tremendous job with it.
I will say that when I travel through the facility, especially early on, sometimes it was difficult for staff to get into the routine of having the PPE on as it should be, not having it under your nose or a little less than you should. Rehab has always done a tremendous job. How has that been received by the residents? When you come in and see me and you're in full PPE, that's a little different interacting with people, as it's a little different today, right now, versus not having a mask, right? We're not seeing as much of us. How do the residents respond to that? How have they responded?
Before I start my treatment, I explained to them why I'm wearing my equipment, my PPEs, and somewhere along the way I make them feel like they're, because you have all this
You're completely, it's like a block.
A barrier.
Yes.
I don't want them to feel like they're having something infectious or
Right.
so I make sure that I build rapport with them, and I make sure that they understand it's for their protection too.
Right.
So yeah, making them more comfortable with what they see, and the therapist perspective, to be honest, it's so hard to work with gowns and the face mask and the face shields because it's so hot, we sweat. Sometimes it's hard to concentrate on what we're doing, but I think it's so worth it.
So in other words, when we're finished with COVID, you'll be rather happy that you're not having to be in full
That's true.
protection
Yes.
mode, right?
Right.
Yes.
But at the same time, and I think that families may be interested in a little discussion around this, you are still providing some touch that they need, we all need, right? So we're gowned up in masks and gloves, but there's still that happening too. Is your ability to actually work with and touch compromised, do you feel, in this?
Well, we make therapy fun. It's personal.
How do you do that?
I ask about their family members, what they're interested in, their hobbies, and I try to connect with them in a personal way, and at the same time delivering my therapy services. So it's a balance between the two. Sometimes it takes time to finish, but when they have fun doing their therapy, I think that helps them motivate to continue and improve and be more motivated.
Yeah.
So,
Like Lucille said, I think a lot of it more is conversations with the residents, as we're providing our services, talking to them about likes and dislikes and, things that they've done in the past, interests, that sort of thing, and kind of incorporating that into our therapy services. For me being a speech therapist, working with them on, where do you like to go out to eat, that sort of thing. And having that as a goal for them to be able to do that once they get out of here.
Brian, overall, the goals the outcomes that we're seeing, have they been diminished by this? Do you think is that being seen by virtue of the fact that it's taking our residents longer to get through therapy? How would you see the outcomes associated with the residents as related to COVID? Any change?
No, I think that's a great question. I think the outcomes have been pretty much the same. Our goals never really changed. Like we said, we made them, things a little more individualized, which has always been our goal, is to make our treatment plans for that individual resident. It is definitely taking a little longer. I think, the going into the isolation for the 14 days, which is great for their protection, but it also makes it a little harder for us to accomplish some of the things. So we have to get a little creative at times into what we're working for. But we also have to think about the fact that these residents are going home to an environment where they're being asked not to go out in public, they're being asked to stay home. So we also need to keep them a little longer to make sure that we're covering the things that they're going to need to do at home.
All right. Well, that about wraps it up. I certainly appreciate your time, Brian and Bree and Lucille. It hasn't been mentioned here, but we are still planning to have our alumni function in the fall, God willing, and hopefully we're going to be able to get together and enjoy our company in a very different way. And so that's all we have for now, and we'll see you next week. Thank you so much.